Good day, everyone. We are the third group, and today we are going to tackle about the important healthcare or medical laws in the Philippines, prioritizing medical professional, patient, and the law. So I'll just give you a little history of the Philippine healthcare laws. In the early 1960s, a vision for a better, more responsive government healthcare program was prompted by the passage of several bills that had significant implications on health financing, which will be discussed on the next few slides.
The Philippine healthcare system. The Philippines has shown significant improvements in health outcomes. It continues to deal with inequities and new challenges that threaten the health of its population. High quality healthcare helps prevent disease and improve quality of life. Improving healthcare quality and making sure all people get the healthcare services they need. Helping healthcare providers communicate more effectively can help improve health and well-being. Next is leadership and governance. Aims to clarify and delineate the overlapping functions of government agencies. Governments that currently lead and manage local health systems will transfer these functions to their respective provincial and city governments, which will become the focal points of local health governance. They will be responsible in terms of administrative and technical supervision, health services delivery, and local health system management. Next is service delivery structure. To address the fragmentation of service delivery and move towards providing comprehensive and integrated care, providers are encouraged to form province and city-wide. A healthcare delivery system is an organization of people, institutions, and resources to deliver healthcare services to meet the health needs of the target population. So, what are the services provided? Services provided include primary care, hospital, outpatient, home health, and rehabilitation. Next is PhilHealth.
PhilHealth membership is currently achieved through a variety of subsidized and contributory schemes. PhilHealth is around to provide healthcare benefits to all members. Its main goal is to ensure the health of every Filipino through social health insurance regardless of social status, may it be poor, rich, young, old, sick, healthy, working, or jobless. Before, when there was less healthcare laws implemented, there have been a lot of deficiencies when it comes to providing healthcare services. Let me start with the access to medical products. The Philippine market for medical products lacks effective government coordination and control, and its inefficiency has led to uniquely high drug prices. The UHC law or the Universal Healthcare Law mandates the establishment of a health technology assessment, which is HTA, council to guide pharmaceutical procurement, which will ensure that the most cost effective and affordable medicines, supplies, and commodities will be purchased by the government. Next is the health workforce. There is a chronic deficiency of healthcare professionals, especially in geographically isolated and disadvantaged areas. Some of the main reasons for this include difficulty in attracting personnel, lack of resources to finance the positions, or weak prioritization by local government units or LGUs. Additionally, undergraduate training programs for health professionals in the country do not feature specific training for the provision of primary care. To address healthcare worker deficiency in the short term, the DOH will expand its deployment programs to augment workforce needs. All government sponsored scholars will be mandated to serve in DOH identified areas for at least 3 years. In the long run, the law envisions that LGUs will be capable to independently finance and manage their own health workforce. The law also focuses on strengthening the provision of primary care through appropriate training of human resources. It mandates realignment of undergraduate and graduate curricula for health professionals to focus on forming essential primary care competencies while those long-term change is being pursued. A primary care certification will be required for health professionals to practice as primary care providers. Next is the health information systems. Health information systems have been challenged by a lack of structural and technical capacities, duplication of efforts, and unconsolidated and incomplete data. Lack of interoperable mechanisms to bring together multiple information systems lead to inefficiencies and restrict data consolidation. Next. So the lack of medical services has finally been heard when President Rodrigo Duterte signed the Universal Healthcare Bill into law last 2019. The Philippine Universal Healthcare Law aims to address the issues of the country's fragmented health system through the establishment of province or citywide health systems. So the Universal Healthcare Law mandates the maintenance of interoperable information systems and standardizes the necessary health data for collection from providers, which are required in licensing and contracting agreements. So these are the other Philippine healthcare laws. It is a Republic Act, which means an act passed by Congress of the Philippines, while the form of government is the Republican government. We have here Republic Act 349, which legalizes the use of human organs for surgical, medical, and scientific purposes. Next is Republic Act 1054, which requires the owner, lessee, or operator of any commercial industry, industrial, or agricultural establishment to furnish free emergency, medical, and dental assistance to his employees and laborers. Next is Republic Act 3573, which is the law on reporting of communicable diseases. Next is the Republic Act 2382, which is the Philippine Medical Act that regulates the practice of medicines in the Philippines. We have also Republic Act 1891, an act strengthening health and dental services in the rural areas. Next is the Republic Act 5821, which is the Pharmacy Act. And next is the Republic Act 6972, daycare center in every barangay. Republic Act 7160, it is the local government code. The Republic Act 7164, the Philippine Nursing Act of 1991. And the last in our list is the Republic Act 6511. It is an act to standardize the examination and registration fees charged by the national boards and for other purposes.
The impact of healthcare medical law to the medical professionals. President Duterte has just signed a universal healthcare bill into law that automatically enrolls all Filipino citizens in the National Health Insurance Program and prescribe complementary reforms in the health system. It means all citizens are entitled to free healthcare under PhilHealth. So there are four main impacts such as big leap, funding, shortage, and more reforms. So the first one is the big leap. Next. National Economic and Development Authority, which led the crafting of the Philippine Development Plan 2017 to 2022, the signing of the law is a big leap towards reforming the country's healthcare system. It means signing of the UHC law is a victory scored for the health sector. According to the law, PhilHealth members will be classified into two groups: contributory, premium contributors from payroll, and non-contributory, fully subsidized from tax collection. Contributory or direct contributors refers to those who have the capacity to pay. Those are the employees, self-earning, professionals, and OFW. Non-contributory or indirect contributors refers to all others not included as direct contributors. Those are the unemployed people, illegitimate children, adopted below 21 years old, and foster children. Next. So next is funding or providing money by government for a particular purpose. The law also provides for a special health fund that will be created and managed by province-wide or city-wide health system. All income from PhilHealth payment will go to the Special Health Fund, which will be allocated by LGUs exclusively for the improvement of local health system. The crafting of the implementing rules and regulations, which will be operationalized provision in the law, such as budget allocations, health financing, improvements in the benefit packages, among others, is still ongoing. The law provides for a transition period to LGUs and concerned government agencies for the full implementation of the law. Next. Shortage. Philippines being a major exporter of healthcare professionals, it constantly grapples with a shortage of health providers, inevitably leading to poor quality of healthcare and high stress levels among health professionals. The poor state of the population of health professionals in the Philippines is another concern of the UHC law intends to address. The number of health workers in the country is not keeping up with the country's population's growth. Next. The last impact is more reforms. NEDA means National Economic and Development Authority. The enactment of the UHC law is a defining moment for the Philippine health system. We at NEDA are optimistic that its implementation will open the doors for more reforms that will improve the health of Filipino people, Pernia said. He noted that the law brings the country closer to its collective long-term vision. Ambisyon Natin 2040, where all Filipinos live long and healthy lives where healthcare is affordable and accessible. Ambisyon Natin 2040 represents the collective long-term vision and aspiration of the Filipino people for themselves and for the country in the next 25 years. It describes the kind of the life that people want to live and how the country will be by 2040. Next.
We all know that the aim of the Philippine healthcare law is to prioritize the health of public, especially the Filipinos. Benefits of healthcare medical law to the patients. So here are the 4 benefits of the patient. Access to quality and affordable healthcare goods and services. Protect patients' rights. Protected from health hazard and risk. Readily available health service suitable to the patient's needs. So the first, access to quality and affordable healthcare and services. The government knows and understands the problem of most Filipinos when it comes to medical financing. Not all of them can afford, so the implementation of universal healthcare law, a guaranteed equitable access to quality and affordable healthcare goods and services has been provided to the Filipinos. Protect patients' rights. As a patient, we have a certain rights implemented by law to protect, such as the confidentiality of our medical records, right to refuse participation in medical research, and the rights to informed consent. This is mostly applied when a patient is unconscious. The patient has to sign a waiver presumable. Protected from health hazard and risk. This benefit is focusing on all the working individuals with the healthcare law implemented workers on all types of hazards in the workplace and have the right to refuse unsafe work, as well as providing facilities and personal protective equipment for the workers, among others. With this law, the Philippines comes closer to achieving a sustainable development goal to protect the labor rights and promote safe and secure working environments for all workers. So the last one, readily available health service, sustainable to the patient's needs. This is just related to the first benefit, which is distinguishing between individual needs and the wider needs of the community is important in the provision of local health services. Service programs have been initiated for those patients who can afford medical assistance.
All the healthcare laws, most especially the universal healthcare law, is very essential in every nation, in which everyone gets the same level of care, which ultimately leads to a healthier workforce and longer life expectancy. When a person has a universal healthcare from birth, it can also lead to a longer and healthier life and reduce societal inequality. And that ends our discussion for today. Thank you for listening.